Okay, well, good evening, everyone. I'm Robert Cartwright from the Institute of Classical Osteopathy, and we're here tonight to present or get Alice Williams, who is one of our course directors, to talk to you about our course, which is the Postgraduate Diploma in Classical Osteopathy. And so, before I introduce Alice, I'd just like to say a little bit about why we exist and what we do. And so as you're probably aware, Andrew Taylor Still didn't discover osteopathy to treat only musculoskeletal conditions. It was an alternative to the medicine of the day, which was pretty rudimentary. And if you didn't die of the illness, you often died of the treatment. Um, so he was treating people with acute and chronic illnesses very, very successfully. He didn't have a sports injury clinic or a pediatric clinic. He just treated everyone. And he was so successful, this led to a massive influx of people coming to Kirksfield to see him and the need to teach osteopathy to others and the setting up of the American School of Osteopathy. John Martin Littlejohn, who was Scottish, was an early student of Andrew Taylor Still's, and he learnt his osteopathy from Still, and he used the same principles, the same thinking strategy, and the same techniques of Still. And he later brought these back to England, where he set up the British School of Osteopathy and taught osteopathy as he'd learnt from Still there while working in practice, treating all manner of illnesses, as well as bad backs and necks and shoulder pain and that sort of thing. But it was called general practice then, where they would treat all sorts of maladies. But after John Martin Littlejohn died in 1947, this broader scope of osteopathy was moved from the British School of Osteopathy curriculum, and gradually osteopathy became the sort of MSK therapy it's taught as today. And some of Littlejohn's students objected to this, such as T.E. Hall and John Wernham, and they then set up a postgraduate group in 1954 to preserve the original osteopathy as taught by A.T. Still and Littlejohn. And this postgraduate group is now called the Institute of Classical Osteopathy. That's us. Now, John Wernham, who was one of Littlejohn's early students, who was at the British School of Osteopathy in the 1930s, he lived and practiced until 2007, where he died at the age of 99. And he taught a lot of our teachers at the Institute. So we have this nice apostolic succession to A.T. Still. We have A.T. Still, John Martin Littlejohn, then John Wernham, then people like Chris Campbell, Chris Batten, Henry Lee, uh, Miriam Elkin, and people like that who were taught by John Wernham himself as well. So we run courses teaching graduate osteopaths mainly across Europe, particularly in Italy and Spain and Finland, and we teach graduate osteopaths how to work in this classical framework. Classical meaning or pertaining to the original osteopathy rather than what it was adapted to in the last 70 odd years. And so this broadens people understanding of the scope of osteopathy, and it's a wonderful lifelong journey and development as we discover how to help our patients more and more. And we have an organisation which is run through our website, where we have a register of members and a Find an Osteopath page. And this is for people who have completed our postgraduate diploma in classical osteopathy, and they become a member of the Institute of Classical Osteopathy. But you can also join free as a student, and you get access to our webinars, free access to our webinars rather than having to pay for them. And you get a discount on the books that we publish from our bookstore. And we also sell a number of other products from the bookstore. So if you're a member, you get a discount on those, as well as discounts to our conferences. And we also have a collection of podcasts called the Classical Osteopathy Podcast, which you can find on Spotify uh, or Apple or most other podcast providers. And we have a YouTube channel where we have a lot of content on there.
Can I ask a question, please?
Yeah, sure.
Did you stop selling DVDs?
No, we ran out.
Oh,
Which DVDs are you talking about?
because before you changed your website, you developed your website. So before that, you had an online shop that you can buy DVDs. Uh,
Yeah.
and now I don't see it on the site.
Okay, well, I'll double check that because they should be. Some DVDs we need to get reprinted, and I have people saying to me, "Oh, no one has a DVD player anymore. Everyone streams stuff." But we do have demand for DVDs still. So we had a lot of the
Because the things you have on DVD, you cannot get them otherwise.
okay, okay. You should be able to stream it through there, or you should be able to buy the
Oh,
DVDs.
where can I see it streaming?
Okay, you should be able to do that through the website, but
Oh,
I'll
that I
get
did not
Sean
know.
on to have a look at that, and we'll check that for you.
Thank you.
Okay, so for more information, apart from about DVDs at the moment, go to the website, which is www.classical-osteopathy.org. And if you book to go on the next course, which is starting in the next academic year, September, October, you'll get 10% discount off the course if you book before the 1st of January. Now, I'd just like to pass you over to Alice, who is one of the course directors. Alice is an extremely intelligent individual, super bright person, and she's a wonderful osteopath and incredible teacher. So over to you, Alice.
Hi, yeah. Okay, so I'm going to just share my screen. So let's do that bit.
Oh,
Share it's not turned on, Rob.
there we go.
You get that bit done? Okay, let's try that again. Okay, now I think this should work. Let's see. I'll put that on slideshow. Hopefully that works. No, it's not doing anything. Oh, okay, there we go. Can you see that okay, Rob? Okay, so yeah, well, as Rob said, welcome everybody. Thanks for joining us today. We're going to just explore a little bit about what classical osteopathy really is and why so many practitioners are drawn to it and come on our course. And a little bit about what our training involves. We get asked a lot of questions. We were up at the IO conference the other day, so we've got a list of questions from there, and we get questions on the website asking about it. So we thought it'd be a really good idea to do a little webinar just to sort of let you know. But yes, if you've got any questions at all, just chip in and let us know. So how do I go on to the next slide? Oh, yeah, here we go. Okay, so this is what I'm going to cover. Just a little bit about who we are. Well, Rob's covered a bit of that already. A little bit of why you might want to do this course, why people come on the course. A little bit about what's taught and the teaching and how we teach things. Where and when the course takes place, how much work's involved, what are the costs, and if you've got any other questions, then we'll be happy to cover those as well. My goal here is simply to get clarity so that you can see whether this training is the right fit for you, how the course is structured, what the workload looks like, whether this is something you'd really like to engage with, and whether that's what you're after. So let's start with the first one there. So who are we? Here are these people that Rob was talking about. Here's Andrew Taylor Still, who you've all heard of, I'm sure. And not everybody's heard of Little John, but Little John was one of those amazing guys who ended up in Kirksville receiving osteopathy because he was terribly ill at the time, and just being converted to osteopathy, just being fascinated by it and wanting to find out more about it. And whereas Still has sort of really started by studying anatomy and observing changes in anatomy with the sort of presenting complaints of the day, Little John really tried to sort of bathe that in physiology, if you like, because he already had an understanding of how the body worked. And yeah, he tried to really put the two together. So he's very much more coming at it from a physiology sort of point of view, and sort of, trying to sort of develop what Andrew Taylor Still had started. And he brought that back to the UK, as Rob said, and founded the British School of Osteopathy at the time. And he taught T.E. Hall, this is T.E. Hall, and John Wernham, the very amazing John Wernham. He was, I think, a neighbour of Little John's, originally a war photographer, and yeah, he was also very much a journalist, and he very much sort of documented a lot of the sort of stuff that Little John was doing, and really tried to sort of pay that forward so that it didn't get lost. And he tried to found his own school, and the Osteopathic Institute of Applied Technique was established in 1956 by John Wernham and T.E. Hall. And it was, really to bring together all the members of the profession who wanted to carry on with this approach, from the early, as had been passed down from our early osteopathic pioneers. So, our sort of, if you go look at our sort of charitable objectives, it's all about education. It's all about bringing those original principles of osteopathy forwards, and maintaining that. In the modern age, I mean, obviously, modern understanding of physiology develops. So we're not sort of trying to not sorry. We're trying to sort of keep that going, and bring that along too. So yeah, who's it? Who are we? Who are we? This is our current group of students, and a couple of teachers in there as well. So yes, we tend to see a wide range of osteopaths coming along to our courses. We get about, in the UK, we get about 50-50 UK students and foreign students coming along. So quite a few Scandinavians this year, quite a few Germans. We get new graduates, people who've literally just qualified, to people who've been qualified very many years. Extremely experienced osteopaths in their own right. And as Rob said, we also run the same course, as well as running it here in the UK. We run it in Spain and Italy and Finland. Italy is the only group that's taken on board our full postgraduate diploma in classical osteopathy. So if you happen to speak Italian, you can always go and join the group over there, which is quite fun. One of the questions we get asked is, do you need to be a qualified osteopath to do the course? Yes, you do. We don't take students anymore. We did used to, but we find it's better once you're qualified to sort of to do this then. If you're qualified overseas, then yes, your qualification will have to be checked out, just to check that you're going to be at the right standard to do the course before we start. So yeah, so any queries on that? Anybody here with overseas qualifications, or no? Okay. So why do osteopaths come on our course? This is a question I ask everybody who turns up on the course every year, and really we get most practitioners reporting a sense of feeling that they've got something missing from their practice or their training. And this is a common driver for people to come and seek classical osteopathy, to come and seek out what it is that we can give them. Sometimes they've seen some of our YouTube channels or some of our videos, or listened to some of our podcasts. So they've got maybe an idea that here's a group of osteopaths that really are treating a little bit more than maybe they're treating, really are taking on cases and having success with cases that maybe they're referring on and not knowing how to deal with, and they'd really like to sort of expand what they're doing. And what people tend to say they're missing in their practice, principles. They might have had principles at the beginning when they started training, they must have been mentioned in year one and then really not mentioned again. They might be feeling like they're missing that scope of practice, just not being able to engage with as many patient presentations as they'd like. And they feel like they're missing a rationale for treatment. There's a disconnect, I think. And this is no criticism of the colleges, because I don't really want to go there, but it's just a fact. People come out from their training and feel like they have missed the connection between principles and treatment. How do you get those principles into your practice so that you can have a rationale for treatment, so that you can treat a broad range of patient presentations? And some practitioners reach this point very early, some reach it much later on. They just feel that something isn't quite adding up. Techniques might work, but somehow they feel disconnected. For me personally, when I came into osteopathy as a student, when they explained principles in year one, I was fascinated, because my background was in physics. So the idea of looking at the body with a holistic lens was made sense to me. That was a concept I understood from my physics background. And when it sort of got to the sort of practical side, the clinical side, it really wasn't following through. So I got very frustrated even as an undergraduate, and came and did the ICO's postgraduate diploma in classical osteopathy as an undergraduate, because I was so frustrated with the training. Other people, this happens much later. Rob, I think you said you'd been practicing a number of years, hadn't you, before you?
Yeah, 10 years. Yeah, and I think after about 6 years, I got to the point where I thought this isn't, because I'd read A.T. Steele's stuff and that sort of thing, and it wasn't doing what it said on the tin. And my practice didn't really resemble any of the results sort of Andrew Taylor Steele or the early osteopaths used to get.
Mm. Yeah, so this is common. This is common, I think, a common experience. This idea of a lack of principles, maybe very much a focus on either regions or individual pathologies rather than whole body mechanics and health. A sense of sort of inconsistency or incomplete explanations, and maybe a limited rationale for treatment choices. And really, it just comes down to this idea, this sense that anatomy and theory and practice don't really sort of fit together in some way. It's like we learn all this stuff, but then why have we learned it? What do we do with it? How do we use it? How do we put these things together? And I think that's where many people who come to us are when they come. And I kind of feel it's our job to fill that gap. I think this is what we're here for. This is our course mission. We want our osteopathic students to be able to independently create principle-based, justifiable, classical treatment suitable to a broad range of patient presentations. That's our mission. That's front and center in everything that we do. One question I got asked at the IO conference the other day was, why come to you? Why not go to one of the other postgraduate providers? I mean, you've got Sutherland's with the cranial, and they've got a wide range of courses. You've got the Renzo with his women's health course. Why not go and do these other courses? And I think those courses are great, and I have done certainly parts of the Sutherland one, and I know one of our colleagues has done Renzo's course, and it sounds fascinating. But I think if you want a thought process, if you want to be able to sort of really put your principles into practice, do this one first, because then you can go and do the other things, and they're going to make a lot more sense. Classical osteopathy really will sort of reconnect you with the sort of idea of whole body principles, this idea of mechanical unity, this idea of treating causes, not symptoms. and that original osteopathic rationale that Andrew Taylor still came up with, which is, it's amazing. So if we're going to do this, what are we going to need to teach? If we're going to produce this independent, rational thought process, we're definitely going to need to go back to those principles. You see a lot of talk out there about principles on, some of the chat groups, Facebook and that sort of thing. Principles are outdated, principles need modernizing, all these sorts of discussions go on. The principles are great. They're a really elegant set of very straightforward descriptors of where you need to stand to look osteopathically. And you don't need they don't need anything adding to them. You really just need to sort of spend some time with them. And if we do that, if we spend some time with principles, if we really try and put ourselves in that place where those principles describe the view, then this logical thought process that we can sort of apply whatever the patient, whatever the presenting complaint, whatever's walked into our clinic, it is kind of just going to fall out the bottom of that. And it really does just derive from those original principles of osteopathy. And that will automatically take us away from symptomatic treatment to wanting to have a whole body approach to our patient. And that is the other thing that we are going to be teaching. We are going to be teaching you a practical sense of a whole body approach. So in a way, I don't know how much percentage is theory and how much percentage is practical. I think it's about 60-40. We have a couple of hours lectures, and then I think it's about an hour and a half practical in a morning, and then again in an afternoon. So what does that translate as? About 60-40, I think. So, I mean, sometimes, although it's a theory class, it might very well be hands-on. We might be doing group work, or we might be doing something else. Oh, hello. Someone sent me a little message. I found after doing the course, I didn't have heart sink patients anymore because I could methodically work out a patient's journey in line with their tissues so much better. Thanks, Pindy. Yeah, no, it's true, isn't it? It's those sort of patients that walk in and you're just saying, oh no, what am I going to do? Oh, I'm going to have to refer you. I don't know what to do. That's exactly what we're trying to avoid. We want to have a thought process that can be applied whatever the complaint that's walked in, whatever they're pissing and whinging about this time. Oh, I'm probably not supposed to say that. Okay, so here we go. This is just a little visual of what I mean when I say that. It doesn't matter what they've come in moaning about. It can be any cell in the body, any tissue, any organ. We are not just looking at the musculoskeletal system. We are looking literally at anything that goes on in the body. And if we're thinking about the body from this point of view, then automatically we will start thinking about, what demands are being made here and what's the state of the supply to this tissue. So you might have blood coming in that's been altered in some way. You might have drainage going out that's been altered in some way. You might have the neurological feedback loops from the sort of higher centers in the body might have been affected in some way. And all of this stuff, when you look at your patient and the configuration that they're in, is going to be in a certain way in that person. And it's going to be by looking at whole body mechanics and looking at the configuration that's there, you're going to be able to predict in a way what tissues are going to be in trouble, what organ in the body, what structure in the body is not going to be getting the supply or is going to have too much demand on it. And this is just going to be so easy to apply to anything that's going on.
Excuse me, can you please elaborate a little bit what I'm looking at and exactly what are the parts of this diagram?
Oh yeah, okay. So down the bottom here, we're looking at a tissue. It doesn't matter. It could be a muscle. It could be the bladder. It could be anything in the body. Yeah. So any structure that is potentially the patient has come in complaining about. I'm very into color coding. So yellow is nerves, red is blood, blue is venous drainage, and green is lymphatic drainage. Obviously, you know, the heart and the lungs and all the other organs in the body are going to be involved in the blood supply to whatever tissue we're talking about. And all the sort of systems that are involved in drainage. So you might be thinking about posture, you might be thinking about pumping mechanisms of the diaphragm, you might be thinking about cavity pressures. And then up here, we've got higher centers, so brain and spinal cord. And you're going to have neurological feedback loops that are in charge of how whatever the organ or tissue or cell in the body is functioning, aren't you? So essentially, if we can look at the body in this way, you can realize that whatever cell or tissue or organ you're looking at that's symptomatic, you can realize that, okay, so we've got pathways and routes of blood and drainage. We've got pathways of neurology, all of which in an altered physical position could be potentially altered. When you then look at whole body mechanics, you are going to be able to look at that mechanics and you are going to be able to predict or say how all of this is affected. So you're not anymore just thinking in terms of muscles and bones. It could be anything. And we can expand that out. And I don't want to spend too long on this because obviously this is part of the thinking that we will try and teach you on the course. But we are looking for how, given the current configuration of the person, that individual is experiencing the world in the way they're experiencing it. And that's where having a universal thought process to apply is so important when we're approaching our patient. And I mean, this is quite a simple picture. Obviously, the mechanics are a little bit more complicated, and you'd have to add that into this. You know, maybe you're not necessarily thinking about a cell or a tissue. You might be thinking about a process that's going on in the body. You know, maybe the patient's got a fever, or maybe the patient's doing a lot of inflammation, and then you'd be asking how come that was happening. So this is just a bit of a sort of an illustration that we're not limiting ourselves to what that tissue is that we're considering. So it's a different thought process, and this is just a quick illustration of how it's a different. Let's get rid of that. I've got my chat over it. Here we go. So just to sort of try and illustrate how it's a different thought process, here's a little patient. They've come in and they're telling us that they've got pain on urination. And what does the osteopath think? Or alternatively, what does the GP think? If we think about it, okay, we're a practitioner, we've got principles. The GP thinks, okay, what's gone wrong in this situation? Whereas the osteopath is thinking slightly differently. The osteopath is thinking, oh, hang on a minute, what's going on here? It's not what's gone wrong. It's more like, how is this right? Which is an interesting question to ask. And that leads to different ideas of diagnosis, whereas the GP is going to go, oh, it's cystitis, it's infection. You know, we're going to be thinking, oh, hang on a minute, we've got cystitis. Okay, fine, that's a name. But what is that? That's a whole body healing process in action. That's inflammation going on, you know, maybe with some bacterial colonization. How come that's going on? You know, if we've got a sense, we need to come up with an anatomical description that makes sense of this behavior, which is inflammation of the bladder. and the associated colonization. We're not demonizing the bacteria. We are understanding that bacteria will colonize when we provide them with the conditions. So how have we provided them with the conditions? What has happened to the supply demands that we just had on the previous picture? What has happened to the roots and the relationships and those mechanisms of perversion to the supply? What's happened to the communication with the higher centers in the body and the neurological connections? What's happened with the body's arrangement with gravity and the forces experienced by the bladder and the fluid dynamics in the body? So this will become our diagnosis. What has happened to that tissue for supply not to be able to meet demand anymore, for bacterial colonization to be possible, and for the healing process of inflammation to be necessary? So it's a different process. We're not just giving it a name, we're understanding how come that name is there. The GP will see there's a sort of inflammation infection is wrong. They will look to decrease pain. They will look to decrease the inflammation, and they will look to kill the bacteria. These will be their aims. Our aims are different. We want to restore that supply-demand ratio. We want supply to be greater than demand, not less than demand. We want restoration of normal functioning with no tissue damage, no scarring, no weakness, no compensation elsewhere. And that's a completely different aim. And this will lead to completely different treatments. The aim to kill the bacteria will lead the GP to give the patient antibiotics, but that hasn't addressed any of this stuff. It's not addressed any of this sort of reasons why that inflammation and colonization was necessary. So we have a whole body situation with the individual that will need to change so as to restore blood flow, to restore drainage, to decrease demands on the tissue and support the resolution of that inflammatory healing process. Yes, like the GP, we do want that pain and inflammation and bacteria to go away, but that's going to be a byproduct of a successful intervention, not the aim of the intervention. And it leads to different outcome measures as well. The GP will say, does the bacterial infection clear up? Well, yes, it does. So great, they're happy. And they might do research into how effective different antibiotics are at treating cystitis. Whereas, we're not that concerned about that, because we know, as osteopaths, we know if supply meets demand, we would not be providing the conditions for colonization. So the bacteria would not have anywhere to live. So that's not going to be an issue. We're not terribly interested in what they're doing, and we're certainly not interested in their research into it. Rather, we're asking, has the tissue exhibiting symptom resolved? Is the tissue now better able to withstand load than previously? Is it more resilient? Has the whole body situation changed to the point where this complaint in the first place is no longer an issue? The supply meets the demand of the bladder. You haven't got an overload, you haven't got undersupply, and the body is no longer in this situation. Any questions on that one? There's a little bit of a trying to sort of point out that, if we change the principles at the top, it completely changes the direction we go in. It's a completely different pathway. And you can't just go the same way as the sort of normal cultural context of thinking around what goes on in the body. You have to change the direction that you're going in. And that leads to a very different sort of end result. And this is a direct result of having a different set of principles in the first place. So that's just a little brief overview of what we teach, because that sort of maybe gives you a sort of a way into it. What do you reckon, Suzanne? You're sitting there smiling. I can see you. Is that sort of terribly confusing?
I think everything. So just to introduce myself, I'm Susanna. I graduated actually only 4.5 years ago from UCO, and I always knew that the course at UCO would not give me everything I wanted. I knew that it wasn't the osteopathy I wanted to learn. And I actually started training with the ICO pretty quickly after I graduated in 2022. And I can only really reiterate everything that Alice has said, but in different words. I think the course has given me a whole paradigm shift in how I now assess a patient. And Alice talks about body mechanics and the configuration of a patient, and that might sound very structural, but actually, if we understand the configuration of our patients, that is, how are they standing? What is their relationship to the center of gravity? Are they more anterior? Are they more posterior? What's going on in their spine? I mean, these clever classical osteopaths who, and I've met a few, they can look at somebody's spine and actually get an idea as to the health of that individual. And I think that's just amazing. So, I got a real I take a much more, I think, more finessed approach now when I assess patients and I look at the whole to try to understand that configuration, because then that leads me on to answering that question as to what's going on. Where is the compressional, where might there be a compressional strain? It's not just about those symptom exhibiting tissues. It is much more. So, that's one aspect. I can talk for ages on this. So if anybody has any questions, do please ask. And, I would also agree that actually the course has given me a much greater scope of practice. And as we've heard, that originally osteopathy, in bygone days wasn't an MSK modality. Now it is. And actually learning, going on this course gave me the skills to broaden how I'm able to help a patient. And so now, instead of being a bit sort of frightened when somebody cites off all these things that's troubling them, which is not MSK, I'm thinking, how exciting, maybe I can help here. So, there is just tons. As I say, I can go on, but please do ask me if anybody's got any specific questions. Oh, can I just add, I was really impressed by the quality of the teaching. We've just heard a little bit from Alice. All the teachers are fantastic. I just want to say that.
Thank you.
Okay. It's completely true. I was really blown away by the quality of teaching.
I think it is. I think we're a good team, and we're quite a varied team as well. This is the lovely Hendrik. This is Hendrik flies in from Switzerland to do some of our lectures on both the foundation and the advanced parts of the course. So if we've got this idea of we want a different thought process and a different practical application, then obviously our training is going to explore these things. It's going to explore the principles. It's going to, once you've explored the principles and sort of realize actually you might need a little bit of underpinning knowledge. Usually it is knowledge that you have learned when you were undergraduates, but maybe if you've not used it since then, you might not have sort of remembered it. So some underpinning knowledge might need to be refreshed. In particular, we find things like the autonomic nervous system is maybe not known as well as it could be. I mean, most students could tell you the root of the nerves in the upper extremity in the arm. If you've got carpal tunnel syndrome, they can tell you which nerves are being compressed in there and where they might be compressed. But most students can't tell you the pathway of the nerves in the autonomic nervous system. So, if I ask them the pathway of the nerves to the stomach or the bladder, they might not know that. So sometimes a little bit of underpinning knowledge might need refreshing from when we learned it as postgraduates. I think it is still in most courses, but maybe just gets forgotten because it's not been used. We do quite a lot of applied mechanics. We do look at the mechanics and how to put that together, how to assess mechanics, and then how to put that together to get to the physiology that's going on in the body, how to understand those physiological processes, and therefore have a rationale for treatment. And we do practical training in a whole body treatment, which is called body adjustments, as you can see from the t-shirt. Here we go. I'm modeling it for you today. Body adjustment, what can I say about body adjustment? Well, the faculty are currently writing a book that's going to be entitled What Body Adjustment Means to Me, which should come out next year, which will be good. I'm looking forward to that. I've been reading some of the entries and they're great. Body adjustment is it's a routine. It's a way of having an interaction, a whole body interaction with a patient, and just getting their body, just having that sort of like physical conversation with the body and getting the body to change a little bit. You know, it's not easy to get change, and we know that, but it's also not a case that we're sort of really trying to impose changes on parts of the body, because that really doesn't work. It sort of tends to just sort of either sort of revert to how it was before, or maybe throw, you know, you might change one bit, but it just throws the problem somewhere else. So it's really about a whole body approach. And we can go into that a little bit more if anybody's interested. So, oh, hang on, I've got a bleep. If I've got a question in the chat room, Rob, you might have to tell me, because I seem to have lost my chat screen. I don't know where it's gone. Okay, so this is how the diploma course is structured. It's divided into 3. We have 8 weekend seminars, and the first 4 weekend seminars, the 4-day weekend, are the foundation part of the course. And in the first 3 of those seminars, we aim to get you to the point where you can make this classical osteopathic diagnosis. And we aim to get you to the point where you are practicing using body adjustment in your clinic. After the 3rd foundation seminar, when you've started to get the idea of making an osteopathic diagnosis, we get you to do a presentation of one of your own patients, and you do this in your own time on your computer and send it in, and we give you feedback on it. And then in the 4th seminar, we do a little bit of troubleshooting on the practical side, just to see how people are getting on at that point. Because then what we do is we have a little bit of a gap, and we have the applied. And the applied is sort of, I'm not sure if it's weekly or fortnightly online tutorials, which are very, very small groups with a tutor. And you bring your own patients, not physically bring them, but, you know, talk about your own patient with your tutor, and you know, practice making these diagnoses and getting hints and tips and filling in the gaps, as it were. And that goes on all over the summer. And then in the autumn, I think in the autumn, or maybe just before the autumn, we start on the advanced. And then there's 4 more seminars on the advanced, where you really look to deepen that understanding of the classical diagnoses and what the meaning of that it can be physiologically. And you look at quite a lot in terms of pathologies. How can patients get to pathologies? How can pathologies resolve once they're there? So really, really interesting. We get some really interesting tutors who come in and talk about their patients and talk about different things that go on in the body. And these essential practical skills of body adjustment are taught and refined throughout the entire course. Okay, so sort of divided up into those 3 sections, but we do aim to get you to fairly quickly to get you to have this idea, and then a lot of the rest of it is, okay, the applied, we're getting you to practice, we're getting you to reflect on what's happening in your clinic using your diagnoses and using your body adjustment. And then we kind of try and deepen that understanding, deepen the understanding of the mechanics, apply it to more and more situations, so that we can see how far it can go, really. And really, in a way, there's no end to how far you can go with this, because you can be practicing and reading and exploring the human condition forever. But yeah, no, it's that's how it's structured.
We do have a question from I think Loki or Loki. I'm sorry I'm not pronouncing your name correctly there, but he's or she has asked. This is definitely exciting to listen to. I'm a year out now, and I'm fairly confident in having the thought process you've just set out. But I'm just finding all the gaps in my knowledge to know the answers to the questions I know to ask. I'm sure you'll get to it, but I'm excited to see what sort of anatomy and specific knowledge is going to be covered in this course. And then a smiley emoji.
Right, okay, yeah. So in terms of specific knowledge and what we cover, you are going to need to know your autonomic nervous system pretty well. That tends to be the biggest gap in people's knowledge. Just because, if people I mean, they've probably learned it as students, but maybe not actually sort of where it is. I don't know if that sounds daft, but I mean, the actual pathways of nerves, the pathways taken by vessels, blood vessels, lymphatic vessels, where they actually travel is actually quite important, because you're going to want to know if it's getting perverted at any point along its route. So those sorts of things, the sort of detail of neurology is probably the most lacking. Physiology, I think, again, if you've not used it since year one, then people might not have as much physiology as they maybe need to understand the processes in the body. So just sort of being able to understand what the body's doing. I mean, there's not actually that many physiological processes that the body utilizes in terms of how it can respond, but it's got a few, so we do need to understand the physiology, and so the endocrine system comes into that as well, and the hormones and things like that. I think most people have pretty good anatomical knowledge for the sort of musculoskeletal system. I think students coming out of college are usually pretty good on that. Understand, they know their muscles and bones and nerves splice muscles and things like that. But mechanics, we do quite a bit of teaching on the mechanics, just sort of how the body works, if you like. Does that answer that question, do you think? What do you reckon, Rob?
I think so. I think so. It's the course is very broad, and we cover a great range of things. A lot of thinking is, or a lot of it is directed towards understanding how to utilize the principles
Yeah.
and how to see that patient. So, because we're very brought up in the allopathic mindset, and Andrew Taylor Still, what he did, he stepped away from that allopathic mindset to look at the problem differently, which is how Alice was explaining the cystitis urinary tract infection case. And so the allopathic view is one way, and the osteopathic view is another. So we teach you how to utilize the principle of the osteopathic thinking, and then take that to the table, which is one of the really critical things. It's one thing knowing it and being taught it, as Alice said, in the early years as undergraduates. It's then taking it to the table, and that's where often our undergraduate training these days sort of breaks down a bit, and for a number of reasons, really, which, as Alice said, we don't really need to get into. But
Yeah, no, I agree there, and yes, we do have some reading and materials. We have, for example, there's a webinar about the autonomic nervous system, just to support people in learning that. I think I recorded that a couple of years ago.
yeah,
And we've also got, just sort of like, for example, when we teach mechanics, there are some basic mechanical terms and just physics, so we've got a worksheet for that. There's a pre-prepared worksheet just to sort of get the basic, just to make sure we're all on the same page, because a lot of people probably have some sort of structural mechanical understanding, but just to make sure we've got all the terms defined and things like that. Yeah, so we do not everybody does worksheets, but some of the lecturers, I'm very keen on having a worksheet. So I've always got a worksheet up. If I've given a lecture, I'll put a worksheet up. And those are designed to sort of try and guide you with your thinking, with the next step that you need, whatever it happens to be at the time. And eventually guide you towards the presentation that you give at the end of the foundation. On the foundation stage director, if you like. So I'm involved in getting you to that presentation at the end of the foundation. And then, the tutors who do the applied will be very much more sort of one-on-one, doing that on a week by week basis rather than giving you a lot of things to read necessarily. Okay, so this is the village hall where we do it. You can see our lovely Hendrik there again. He's doing a nice theory lecture. I think you're there, Suzanne. Yeah. And sometimes, we stand and talk, and sometimes we get you to do some standing and talking. I think here we've been looking at the thoracic spine, or I think that's thoracic. I don't see terribly well, maybe numbers. And this is a group of students who everybody's looked at a different area and then standing up and just saying what they found and what they've thought about. So I guess, again, getting you to sort of take it back to the body and take it and share knowledge as well, which is quite good way of learning. And yes, lots of practical, we try and get group sessions going as much as possible. This is one of our lecturers, Ben. He's looking at some interesting mechanics and what's going on there. And this is a whole group session. Quite often we'll do something where we've got everybody on tables in a loop like this, and we'll go around and just get everybody to move around the bus and feel the same thing on lots of different, thank you, Suzanne. Lots of different people feel the same thing, sort of idea. So, okay, so here's our timelines. You can see that we've got the dates there for the next course, and you can see where we put the presentations in there. So this presentation, the foundation presentation, you do in your own time at home and then hand in, and you'll get feedback. This presentation you do at the end of the course, you do it in the room, and that would be assessed by Chris Batten. Usually Chris Batten and Min would come along and assess that one. And there are a lot of webinars and support material that we've recorded over the years, and we will make available to you.
I have a question, please.
Uh-huh.
I saw someone wrote it, and I also have the same question. The second stage in which we meet in small groups, do you know which days and what hours they take place?
That will depend on the tutor and on the group. They would agree between them.
Oh, okay.
Yeah, so obviously you've got to
So it's
find
depending on your availability.
Yeah, exactly. You've got to find a time that works for everybody. So, and some people are in other countries, so the time zones need to be.
And the webinars can be, you can.
The webinars are, if we do them live, we would let you know, but a lot of them are pre-records now, so you can watch them when you want.
So with the live ones, as when you're students on the diploma, you get free membership with the ICO. So you essentially get all the benefits that our normal members get. So you'll also then be added onto the mailing list and everything. So you'll be kept up to date with all the events that we're running and ones that we think that might be of interest to you if they're live ones. And then we also have a library of pre-recorded ones or past webinars, which we can give you access to as well.
Yeah, and some of them, we might say at a particular point, okay, we've done seminar 1, you all realise now you need to know your autonomic nervous system better than you do, so maybe go watch that one before seminar 2, so we'll give you a sort of heads up if we think something's going to be useful. In terms of workload and reading, I think I'll say what I always say. I always think if you've been in a lecture, you need to spend at least the same amount of time looking at it outside the lecture. But again, it really, really depends on the individual. Not everybody likes doing that, and I appreciate that not everybody will do that or have the time to do that. You know, personally, I probably easily spend 3 or 4 times the period of time I'm in a lecture looking at stuff around a lecture and reading and stuff like that. But again, you know, maybe you wouldn't have time. You know, I think some people genuinely do just come along to the course and don't do anything else. I think you could do that, but I think you get more out of it if you put a bit more in. So I would say, you know, do some reading, maybe do some worksheets or some exercises, or you know, just a little bit around sort of building yourself up, if you like. You know, even if it's just once a week, you think about a patient and you try and think about them in the way that we're asking you to think about them, the way that we're guiding you towards thinking about them. You know, that sort of thing is quite good.
But it's one of those things. The more you put in, the more you get out, isn't it? You know, and
It really is, and you are going to be wanting to read these books forever. I still have books on my shelf that I've not read that I really want to read, and I'm sort of, you know, 15 years down the line with this now, and it's my reading list only ever gets bigger. So yes, I don't at this point I think I'm not going to have read them all by the time I die. So it's that sort of thought process, really. So yeah,
it is a fascinating journey, though, isn't it? Because you
it
know
is a fascinating journey.
one of the things I experienced after being an undergraduate, and I see this a lot in osteopaths as well, where they get to the point where they need to add something to their treatment, you know, like prescribing, or they want to learn injections or something like that. And um, if you do this, you don't need to do that. I'm not saying that people don't always need to go off and get medication, or they don't need to have injections, but this is, I found the more research I learned, I read about MSK and tissues causing symptoms, the less osteopathic I became. And when I stopped doing that and I started working like this, the more it expanded. And I graduated in 1997 and started doing this in the about 2009, I think, something like that, similar to Alice. And I'm still learning now, and I love it. I'm incredibly enthusiastic about it, and I get a real buzz about it. And
Well, that's
uh,
it, isn't it? You're never
it's,
going to get
it's
bored.
yeah. You never get bored doing this. So there's always something to learn, and that light bulb moment, which is really, really exciting. And yeah, it's a wonderful way to go through your career,
Mm.
and also you learn how to help your patients much more. It becomes a much more fulfilling experience for you.
Mm. No, I agree, totally agree. It is fulfilling, and you know, there's always something new to learn.
Yeah.
There's a lovely picture of the hall and the pub. So that's about all there is in the village. There's the village hall, there's a pub, there's a little shop, but that's about it. That's where we do it. Um, the costs, we get asked about costs. The course fee is £5,000. There's a couple of ways you can get that down by 400 quid, I think. One is by paying up front, and the second is by being a new graduate. So new grads, Sean, you did tell me. I think for the next course we would take 2025 as a new graduate, or 2026. Yeah, I'm getting a thumbs up. Good. Okay. I know you did that. And yes, you do get a lot. You get a lot for that. That is totally value for money, because you get 8 long weekend seminars. You get all of our resources. You get access to all of our webinars. And, you know, what are you going to gain as a practitioner? You're going to get that clarity of reasoning behind your diagnosis. You're going to get that whole body understanding of what's going on. You're going to be able to treat those difficult acute or chronic cases that just never seem to change. It's a structured, principle-based approach that's very logical. People sort of seem to have this idea. I mean, certainly I've had this said to me, oh, classical, that's, the voodoo, yogurt knitting, woo-woo side of osteopathy. It really isn't. I'm a physicist. If I'm coming at this and because it makes sense, then, it's got nothing to do with yogurt knitting nonsense. It's all to do with making sense of what's coming in the room and being that ability to explain situations logically and to be able to explain that to patients, to be able to explain it to a GP if you need to.
I do it because I understand it to be far more biologically plausible than any other approach that I've seen. So I that's what I have to go by, biological plausibility, and that works for me.
Yeah, absolutely. And you also get to join a community of like-minded individuals. A lot of the time out there in practice, people are working on their own, and they feel isolated and they get bored. And you're not going to get that with us. You're going to be part of this classical team, and we'll take you on board.
Yeah, it's we often refer to it as our osteopathic family.
Yeah,
So we're
absolutely.
all there to support each other
Absolutely,
and to
because
help each other.
if you get a case you don't understand or you're stuck with, then you just go, oh, I don't get it. What's going on? And somebody will go, have you thought about this? And you'll be like, oh, yeah, okay, that makes sense.
And we also run courses when you have graduated. We have a clinic in Ireland where we have Chris Campbell, who's an absolutely amazing osteopath, and he hates me saying that, and so I like to say it even more because it makes him feel really uncomfortable. He's an amazing osteopath, and we have this clinic in Dublin, which has been set up as a charity clinic where people can go and receive treatment. If they can't afford it, it's free, or they pay what they can pay. And it's just there is a set treatment fee. If they can pay more than that, that's great. If they can't pay anything at all, they get treated for free. And because it's an island, which and the legal ramifications are different, you see a very, very broad set of cases and presentations, and it's a really, really fascinating place to go and work and go and do some of the courses there. I go there a couple of times a year, sometimes to do a course, sometimes to teach, and I always come back with something new to practice and something really exciting. So that's that. We don't just drop you after you finish the postgraduate diploma in classical osteopathy. That's really the start of your journey.
Mm. Yeah, and we've got this ongoing pathway. I mean, like you said, we do
Yeah.
these webinars for all of our members, and we've got the clinic over in Ireland, which is fantastic, and the training Chris is doing. Um, yeah, so this training's ideal for you, if you're wanting those solid foundations, if you're wanting to look deeper into what's missing from your current approach, if you want that clarity of reasoning for your treatment, um, and you want that scope of practice in your clinic. If you're drawn to this idea of a whole body and the classical roots of osteopathy, then I really think this is where you're going to find it. There's some student feedback which I'll just leave there for you to read for a minute. But I mean, I think, you just heard from Suzanne. Suzanne came along tonight because I said, oh, Suzanne, could you come along? And, she's a great ambassador for us. She took the course a couple of years ago and she really, really loved it. But it's a common experience amongst our students. They get what they're looking for with us. And I think that's the main thing.
As I said at the beginning as well, is if you do want to join us for our next course, which is September, October next academic year, you can also get 10% off by signing up for it before the end of the year as well. So that's another way you can reduce the £5,000 fee to 4,500. So
And I'll email
October,
you all
October we start. Thanks, Sean.
I'll email you all a code and the adjusted installments, what they'll look like with that discount as well, because we don't visibly show that anywhere. So I'll send that all to you personally, so you've got that updated information with the discount as well.
There are other discounts, but you can only have one. So you can't put this if you're a new graduate and you get a discount for that. You can't put this on top of that, I'm afraid. Otherwise, we won't be able to afford to fly people like Hendrik in and Chris Batten and that sort of things. We fly people in from Europe and Canada, Italy, Switzerland. Obviously, they're in Europe as well, and get because we want the best people teaching you this stuff.
Mm. No, we have a really good team. People come from, like you say, all over really. So it's nice to be able to do that.
Yeah, we're also we're a non-profit organisation. We're set up as a charity, so we don't have to make huge amounts of money to survive. We as long as we can stay afloat, that's all we try and do really. So we try to just make a little bit more than what we need, so we can just continue teaching people this way of approaching osteopathy.
Mm.
I've
Half the time I've
also
got lecturers sleeping on the floor in my clinic so to keep costs down. That works out.
I have one question, please.
Yeah.
Regarding the diploma itself, does it is it recognized? How is it recognized by in Europe and so on?
It's not an academically, what do you call it?
It's not validated by
Validated, that's the
an
word.
external organization,
No, no.
because your undergraduate degree is what's validated by external organizations.
Mhm.
And we are actually looking at processes to do that. Um,
Currently,
uh,
there isn't really a lot
no,
of validation in any of the postgraduate providers. Nobody's
no,
doing that. So,
yeah.
So I would not be recognized as an osteopath in England if I have this diploma.
Not unless you've been to
Yeah,
a
unless I have
college.
a post
Yeah. Your undergraduate
undergraduate.
qualification has to be recognised by the General Osteopathic Council. So you have to have what's called a recognised qualification, which is going to one of 10 UK, I think it's 10 still UK undergraduate colleges to learn osteopathy. Outside of that, if you're in a country which has a recognised structure for learning osteopathy, and it's a recognized course, you can apply to the General Osteopathic Council, but this isn't part of that. This is to joining the General Osteopathic Council won't make you a better osteopath. This will.
yeah, no, we're a postgraduate provider. We're
Mm.
not we're not in the business of qualifying osteopaths. We're in
Yeah,
the business of developing qualified osteopaths.
yeah,
So, yeah, that's what we do. We're not here to get you qualified. We're expecting you to have done that bit already.
yeah,
Yeah. But I mean, having said that, I mean, we do this here, we do it in Italy, Spain also run the foundation parts, sort of an enhanced foundation part of our postgraduate diploma, and Finland, we're involved in the undergraduate college. It's undergraduate, isn't it, Finland?
undergraduate and postgraduate.
Oh, and
We do,
postgraduate.
yeah, yeah,
I don't get involved in Finland.
yeah. But we have stuff being set up in Canada, and we've run courses in um,
Japan.
Japan.
Mm,
And places like that before. We're probably I think we are the oldest postgraduate group in Europe. Having started in 1954.
yeah. So yeah, I mean, it'd be really nice. I think we've got a student in Germany, someone who came and did our course who lives in Germany, and he'd love to get a course going in Germany. He's just got to get enough people together. It really is just a case if somebody can get a group together, we'll do it. We'll be there. So,
How many people?
usually on our course there's about a dozen, but I think we've got more than that interested this time. I think a few more. Is that right, Rob?
Yeah, there's usually um, we need about a minimum of 12, but we don't really like to do any more than 20 because we like small
Mm.
small groups so we can get round everyone and uh, and create a bit of a bond with everyone and a bit of an understanding of how they're thinking and getting to know them and they get to know us and so we can help them develop as much as possible. But I think either 10 or 12 was depending on where you are is the minimum number that it usually takes to make it doable in terms of the costs. But that might be that's certainly for us in the UK. It might be
I'm not
different.
sure. It might be a little bit higher for Paul in Italy.
Yes, it is. It
Yeah.
is because he flies a lot of people in.
Yeah, he's got to fly
Yeah,
us over there. So yeah, when he does a group it's a little bit bigger usually. But not
yeah,
much, not 20, I don't think.
yeah. He's usually closer to 20 or 25, isn't he? I think.
Yeah, a bit
I think
more.
his minimum number might be somewhere around 17 or something like that.
Yeah, I'm not sure. But yeah.
Does
Good.
that help?
Any other questions whilst we're still here?
Yes, I was wondering if there is a cutoff point for registering in terms of like a month by which registration has to happen in order to attend the next course or not.
Sean? Can
In
we do
theory,
it?
no, we can be flexible, but we try to have most people by a month, if not 3 weeks before, just because there's paperwork and stuff that needs to be filled out, and all of that stuff, and getting you onto the system we use. We use Teams so that you can see all of the information and the course program.
Oh,
So that's kind of the latest to do it to get you up to date comfortably and make sure you've got everything you need and we've got all the information we need to get you on the course kind of properly, if that makes sense.
yeah, yeah, it does. Thank
Yeah.
you.
And also to get in some of that pre-course reading, which again not everyone does, but the more you put in, the more you get out. And we do provide some pre-course reading and resources for people.
Okay, so that gets provided as
Yeah,
someone signs
yeah,
up, basically,
yeah,
so they can
yeah,
start. Okay, that makes sense.
So we use teams, and each cohort will have their own sort of area. So that year they'll have their own one where it's just the people on their course, and you'll have stuff uploaded. So we send you like information about the local area, like Alice said, it'll give you some information about accommodation and bits and pieces like that. You'll get your timetables put on there, and then we do a reading list and things as well. And if that way, if there's anything that gets uploaded as the course goes on, it all gets put on there into one space for you all so that you can access it.
Okay, so
And
the
will
reading list would be actual material present on Teams that we could read through rather than signposting to books to be bought. Was that correct?
yeah, yeah,
Yeah, but
Um,
there is a reading list, and even though there is some, there's quite a few different books on there. But like Alice will say, as a lot of the time as well, you don't have to read all of those before you join the class. So you don't have to buy all of those. They're just ones that a lot of the lecturers think would be beneficial to your learning as you go through the course. And actually, as you go through, a lot of the lecturers have access to some of those books as well that they can help with, so that it's not like we're not expecting you to buy a whole reading list worth of books
we've
before you
got a lot
start.
of them electronically.
Yeah.
I mean, if you just want a book to read now, then you could do something like Tucker and Wilson,
yeah,
the theory
yeah,
of osteopathy. That's quite a nice one.
mm, yeah,
Or Hullett's quite a
mm,
good one as well. And that you can get those as PDFs. It's not
mm.
would it be possible to put them on the chat, please? So that because I
Yep.
didn't.
What I'll do is I'll put them in an email because the
Oh,
chat will disappear. So I'll pop them in an email.
Yeah.
thank you very much.
No worries.
We don't expect people to buy all our books, but you'll probably find when you're doing the course, you'll want to.
Mhm.
So, they're there for people to purchase it, but it's not compulsory. There is a lot of the reading material is on archive.org because it's a lot of it's older books. People like Carl Philip McConnell. Um, I use quite a lot of stuff from Louisa Burns when we're talking about that, and some stuff from Irvin Core and people like that and their research. And um, so that's all kind of publicly available and freely available. You can buy the old books if you want to spend quite a lot of money. I have some of those original books, and they're kind of lovely things to own, but it's not necessary because you can download it and print bits off as you need, or just read them on your iPad or your phone or whatever your preferred medium is. But you'll probably find when you get there are some things that you think actually, yeah, I'd like to I'd like to buy that. And it depends what you're interested in. I've always had a real deep interest in osteopathic history. So anything with a bit of history, and I'm there, and I'll be buying it. But I'm a great lover of books as well. So that's just me. But it's not compulsory.
You like the history. I'm not that keen on the
Oh,
history.
I know, yeah, yeah,
It's good for sending me to sleep.
yeah,
But the team will be able to signpost you to certain books that they think will be appropriate at that time of the course as well, and
yeah,
what will help you at that stage. And we do tend to keep some of our own books down at Pease Lake, which again, the staff will say probably at different points, like this one is quite good for where you are at
yeah,
the moment. And perhaps if you're looking at one, they might go, leave that one for a little bit,
yeah,
start with this one. So they'll try and help signpost you as well to what they think's useful and appropriate to where you are in that point of the course.
Oh, that's great. Thank you. I mean, I'm a person that I really need a book
yeah,
or books,
yeah,
but I find that some guidance is important. Otherwise, I end up buying loads and then spending lots of money that and not using them as much
yeah.
perhaps as I wished. So yeah.
Yeah, as a classical osteopath, you'll have a big pile of books that you're still waiting to and still hoping to read. I think most of us have that. Um,
Called the library.
yes, it's called a library.
Yeah.
Yeah, yeah, yeah. And um,
Thank you. I also had another question that popped up before during the presentation. I don't know if this is if there's time for that. It was just like about the body adjustment because I've never experienced that myself, uh, and uh, and I just look at a video online about it, and I've heard people that have experienced it themselves. But I was wondering because you were saying that during the first phase, we are taught the body adjustment in a sense so that we can then use it within our practice. I was wondering how much flexibility there is in it in terms of like, I have different patients and some patients, are not able to lie on their front or are not able, that there is lots of different. So, and you were speaking that you're very much based on principles. So I was trying to kind of fit how does a routine fits with the principles and how adaptable that body adjustment routine in a sense is to all the different kind of like abilities of a patient.
well, I use the body adjustment um, every day, all the day. I'm 60 next year, and I just work 4 days a week now because and then the rest of my time is usually doing institute stuff or Little John Centre stuff, and I treat about 12 people a day. But before COVID, I used to treat about 75 people a week, and I used to treat them all with a body adjustment. But I saw a patient the other day who was 90. I see lots of elderly patients. The oldest patient I've uh, treated with a body adjustment was 102. But if they can lie on their front I lie them on their front. If they can't, I lie them on their side. I treat them on their back, on their side, or some patients I've had in, all they can do is just sit on the side of the table, and you just
I've
have to
got,
work with what they can do,
So
but
yeah,
you
it's
I've
can
quite
got
still do it.
fluid
patients
as a
who
structure.
can't lie down at all, you know.
Yeah, yeah, yeah,
So
yeah,
I've got
it's
a
quite
patient with
fluid
multiple
structure.
sclerosis. She's just in a chair.
All
Sorry.
yeah,
right.
yeah. So that's fine. Don't worry about that.
Okay, great.
Yeah,
Yeah.
yeah.
Mm,
Was
good.
there any other questions from anyone? Oh, we do. One of the things we do with each group is well is set up a WhatsApp group. So it's just a little bit less clunky than using the Teams messaging system. If someone's running late that morning, or if people quite often go out for dinner on the Saturday night at the pub, and sort of more social messaging, or when if we want to give someone a book, a PDF of a book, we'll often stick that on there as well as it being on, the team site. So,
But it
and
also works part of that community, doesn't it? Because we've had them like a couple of years back courses that
yeah,
still someone will pop up and go, I've just
yeah,
had a patient,
yeah,
and they start asking, and then everybody has a conversation about it. So it does, I mean, obviously it can stop if you want it to stop at when you finish studying, but it's also then a place for you to have a safe conversation about patients and things that come up even after you finish the course.
yeah.
So that's the nice side of that as well.
And we're always here as the faculty to, discuss stuff and help people and we do that because our peers have always done it for us. So we want to help people as much as possible because we want to help osteopaths be better osteopaths, and we want them to really enjoy this way of working because, as I've said a couple of times, it's really quite wonderful. Any other questions from anybody? Okay, well, thank you very much, everyone, for joining us this evening. If you do want any more information, please go and contact us or go to the website, which is www.classical-osteopathy.org. Um, Dagenif Frak, sorry, I don't know how to pronounce your name. I have discovered since we've been on that for some reason those DVDs haven't been loaded onto the site. So hopefully we will. Now I'm aware that they haven't been loaded. Hopefully we'll get them loaded up. But there are two of the DVDs we don't have in stock. I know, but the one that we sell the most of is the 4-disc set on osteopathic technique with Mervyn Waldman, and we have had. I had another 200 sets of those printed off earlier this year, so I know we have those. So that should be on the website, and if not, you can email one of us to arrange a purchase if that's something you wanted. Okay. All right. Well, thank you very much, everybody. This video will be edited and put on YouTube at some point, so other people who are interested in our course can look at it as well. And I hope you found it interesting, and it's very nice to meet you all.
Yeah. Nice to meet you all. See you on the course.
Thank you very much. Have a good night.
And
Thank you. Good night.
Thank you.
bye.